we're going to show you how to do a Hoyer lift transfer today. So the patient goes from the bed to the wheelchair. So Kait suffered a stroke. My name's Anna, and that's Paige, and then Chrissy is recording. So right now she's looking pretty uncomfortable, but first you'd want to introduce yourself. So hi, my name's Anna. I'll be your occupational therapist today, and Paige is the assistant. So we're going to move you up towards the pillow first before we transfer you to the wheelchair. It's going to be nice and slow, so don't be scared. We got you the entire time. So first we're going to use the towel here to move her towards the pillow. So we're going to bend our knees, grab onto the towel close to her body, as close as you can get. So get a nice grip, and you're going to lift with your legs and not with your back. So when we count to 3, 1, 2, 3, and move her up. Good. Okay. And then you probably just check in, ask how she is. So how are you feeling now? Comfortable? Yes. Good. Okay. So then we're gonna grab the sling. So this one here has the leg straps on it. There's multiple kinds though that you can choose from. So we're going to, you wanna make sure that the soft part is touching their body and never the hard part. So there's a rough part as well. So, first we're going to, before we even put this thing underneath her, we have to do a little bit of bend mobility to make sure that we can do that. So I'm going to hold her at her shoulder and at her hip, and Paige is going to make sure that she doesn't fall off the side of the bed. So we're going to, on the count of 3, move her towards Paige. So 1, 2, 3. Yep, and then she grabs onto the bed with her good arm there. And that's when I can slip the sling underneath her. So the tag, this kind of helps if you line it up with her head there. Make sure it's straightened out. And then you're going to start rolling the soft part in. And you want to tuck it underneath, make sure it's nice and secure. Have anything touch her. I know it's kind of hard, but okay. And then she's going to roll back towards me. Okay, and then you're going to use this arm here and place it on the side of the bed. Perfect. I'll grab you at the shoulder and hip again, and then Paige brings it out from underneath her. So you want it to be centered, but it's not going to be perfect all the time, but we'll see if we can try to. Okay. So as you can see now, there's a little bit more on this side than there is this side. So we're going to roll you back towards me. Yep. So next, we want to make sure that we do the straps. So the straps on this kind of lift or sling, you go over the leg, right? You go under. Yep, you go under and then back over. So, and then I would probably check in again. How are you feeling so far? Doing well. Okay. And then nothing hard is touching her body, so that's really important. So the soft side is facing us. Okay, so now that the sling is underneath her, the leg straps are all good to go, I would tell the patient, I'm bringing in the Hoyer now, and we're going to make sure that nothing hits you, because it kind of looks a little scary. This is perpendicular to the body. And then this is when you can widen that base of support there. And to do that, we have this here where you want to bring it to the left. So it's just an easy maneuver. Okay, and then I get it as close to her as I can. And then it should be right over her sternum. So right over the chest. Okay, and I'll start bringing this down nice and slow. And then there was a little rule that Dr. Bennett taught us, so I'll show you when we get there. So it's pretty close. And then there's like this rule here, and that kind of shows you that you're good to go. So I think that's good, right? And then you can kind of like step back and even see if it's like over her evenly. So again, the sternum is where you'd want it. And then next we're gonna use the straps here. So they have different colors. I mean, all the slings are different, but
you cross them.
Yeah, you do cross them. Oh yeah, you do. Yep, and make sure you cross the leg strap part as well. And then you're done with the leg straps. But so I'd start from the first one, closest to her head. So, and then you kind of just like you figure out like which one kind of feels secure. So the first one we'll do purple. Good. There's a middle one here. Sorry. Probably like green would be best there. You want it like snug but not too tight. And then we have, yes, the green works for that one. And then probably, I would say purple, green, purple, purple. Yeah. So now we're at this point. We're gonna start lifting her up off the bed, and then, yep, most important part here is like crossing the arms to make sure that they're not gonna be touching anything, and so they're nice and safe and secure. So like you could say, like you're going down a water slide, cross your leg, or cross your arms, I mean. Okay. And I'll start lifting you up nice and slow. So for this part, you want the butt off the bed like probably like by an inch. And that's how you know to stop. It's important to go nice and slow. And then you could even like, just to check, see if you can place your hand under, probably a little bit more. Okay, I think that should be good. Okay, so now that we're here, we're gonna go, the next part of it is to, swing her towards me, because she needs to be facing me. So I'm gonna grab your legs here. And then Paige should just grab her by the side, and then she'll get her back behind the sling. There's 2 straps on the back of it. And then I'll start slowly bringing it out here. You want to make sure that it's not hitting their legs. So, you feel comfortable? Mm-hmm. Perfect. Okay. So now I'll slowly back it up. Yep. And then with the wheelchair, you want to make sure that the leg rests are off of it so that there's enough room to move her in there. And you want to do that before you actually do the Hoyer butt. Because she's comfortable. I'm not moving it without my assistant, but yep, so you can grab the straps there. Good. Okay, so when we move her in, Paige will go back behind the wheelchair. And then it's going to be a lift up and then pulling her back to get her snug in the wheelchair. Perfect. Okay. So I think we're over it good, and I'll slowly lower you. I promise it won't be too quick. And so this here is to lift her up. The little lever on the side is to drop her down. So you just pull on it nice and slow. All right. And then you're gonna want to watch the boom, make sure it doesn't hit her. Bring that down to where it's a good point to start taking the straps off. Okay. Perfect. And I'll just bring it away from her, yep. And then Paige is doing a good job of just pushing it towards me, so it's not gonna hit her. Good. Alrighty. And then having another check-in at this point, so I would say, how are you feeling this far? Feeling pretty good, perfect, good. And then now we have to get the sling out from underneath her so that she can go about like watching TV, eating, whatever she's doing in her chair. Okay. Good. So it's the same as like the bed mobility here in the chair. So I'll grab hold of her shoulder, and this arm can grab the armrest there. And Paige has her over there so that she's not going to fall at all. And it's another like roll. Oops. But still, you don't want the hard part touching the body. Okay, and then the same thing over here. So your other arm can grab the armrest here. And then you just take it out from underneath her, nice and easy. Good. Okay, and then sit her back down. All right. Perfect.